All right, we've come to our fourth and final video. I'm so glad you've been here with me along the way. If you haven't seen the other three videos before, please go back and go through them. I've put them in a special order, so this one will be helpful, but it'll also be helpful for you to have the whole shebang. Okay, so today we're going to talk about mindfulness. And when we talk about mindfulness and trauma, I think, yoga and mindfulness are getting so popular these days. It's great. I love it. Fabulous. More power to yoga and to the people. I also, part of why I want to offer this series is I want people to be able to use these practices intelligently and not in a way that's going to re-traumatize people who are trying to incorporate these practices. So if you're a provider or if you're working with your own trauma, either way, I want to offer a way to be mindful that hopefully feels helpful for you. Now, if it doesn't feel helpful, leave it. But these are things that with, people I've worked with who specifically study mindfulness and trauma and dissociation, and for myself and my practice, that I've found to be most helpful in terms of developing any sense of meditation or mindfulness practice. So it's not going to be a ton to look at because I'll just be sitting, but I'm going to be talking you through finding a comfortable position and just orienting kind of your mind and thoughts. So stay with me, and if you want to just watch and listen, that's fine. If it feels right to practice, you might want to do that with someone, or you might want to use it with your provider. And if you are one of these providers, you're a nurse, you're a social worker, just remember that slower is better. So we never want to go in to trauma treatment and overwhelm someone, right? Because that's already happened. So just remember, baby steps. I always go back to what about Bob? Baby steps. And just focus on finding those little moments of mindfulness. All right, so here we go. So it's time to learn a little bit of meditation skill. It's often said that all of the yoga poses prepare us to be able to sit and meditate. It's also pretty well known throughout the clinical community that meditation can be really hard, and even sometimes the opposite. Mindfulness can be the opposite of some of the ways that we want to cope with trauma. So I could say a ton about that, but what I'll say right now is just feel free to watch this, and whenever you feel ready, you can try along. If it feels overwhelming in any way, definitely work with someone. And clinicians and providers, if you're working with someone, just remember to communicate, and that the bottom line is to help create a sense of safety and comfort, okay? So you're going to find a comfortable seat. I have a cushion. You can sit on a cushion or anything else, but I'm just going to sit cross-legged. So get situated here. I'm going to cross my shins and let my knees drop down. Now, if your body feels uncomfortable here, some people feel better sitting up on a little more height, a little taller. You can experiment. For some people, having your hands up feels better. For some people, having your hands down feels a little more grounding. So I'm going to go hands down. You do what's comfortable for you. Just like we did in our first pose, it can be helpful just to feel your body in contact with the cushion, the pillow, the floor, whatever you're sitting on. And just start by taking a few conscious breaths. Now that in and of itself can be really challenging, but can you just notice the fact that you're breathing and kind of be with that. From here, I want you to pick a single point that's not moving. So we're actually not even going to close the eyes today. I know that's really common in meditation, but we're going to do an eyes open meditation. So I'm actually going to pick, there's a little green light on right next to the camera that says it's recording. So it's going to look like I'm staring at you. But I'm going to pick that little green light, and I'm just going to take a few cycles of breath, and I'm going to focus on that little green light. And as I focus on that little green light, I'm going to say to myself, little green light, because that's what I'm seeing. So this might sound really simple, even over simple. It's like, okay, I'm staring at a light and I'm calling it a little green light. It almost feels childlike. But trust me on this, it's so helpful for your brain. And what happens, and part of yoga philosophy, is that our minds want to go to the future, our minds want to go to the past. Obviously with trauma, our minds really get pulled to the past. So all we're doing in this really simple practice is practicing being present with something that is right now. So I am so connected and attuned to that little green light. And the purpose of this is that my mind, the longer I stay here, is going to want to run off in other places. But I've got this little green light to come back to, and I can always take a breath if that feels comfortable. Take a breath and just say, little green light. So I hope you found something that you can focus your eyes on. It could even be something in the video here, like, I don't know, one of my earrings or something. I'm moving, so it's better to have something that's not moving. And it's really good to find something that's in your immediate physical environment so you can use it even when this video is off. So I'm just going to take one more moment. Such a hard thing to demonstrate because you really don't know what's going on in my mind, but I'm thinking little green light. And I'm feeling my feet on the floor. So you can try that too. Okay? That's what I have to offer for today. It's a very simple mindfulness practice. Again, find a comfortable seat, feel your body in contact with the floor, and to get as present as you possibly can in this moment, pick something in the room, name it, and then just repeat that thing to yourself as many times in whatever pace feels comfortable so that your mind doesn't quite do what it's used to doing, which is what it's used to doing for all of us going into the future and the past. So I really hope this series has been helpful for you. I'm so honored to have you along for the ride, and I really hope you'll share this with people that it can benefit. Again, my purpose in this is to try to get these tools really out of the yoga studio and out into the world so people can use them in their homes, and therapists can use them in practice, in private practice, or in schools, community centers, all these places I've worked where I just know this stuff can be really helpful. So if you have questions on this, please reach out. My online trauma training starts in July, so if you're interested in learning a lot more about this, I've talked about the nervous system, I've talked about trauma. We're going to get into defining trauma, into the nervous system, into the philosophy of yoga, and into how to apply trauma-informed yoga. So whether you're a practitioner who's really wanting to learn, that's really who it's geared to the most, is people who are working in environments with trauma. But also if you're just someone who's really curious and you want to learn about your own healing and empower yourself in that way, you're welcome to come along. I'd encourage you to have support along the way, and even you can bring this to your therapist or to your treatment. Thank you so much again, and namaste.